Castillo. I am from Venezuela, and I've been here for 3 years. I am a medical doctor and a psychiatrist, and when I came to this country, I decided that I have to do something that I love, my passion, that is work with people and work and try to help people to understand themselves and to grow up. And I thought it was a very good way to continue with my passion going into mental health counseling. For me, it has been a very, very, very good experience to go. I am a student I am doing my master's degree in mental health counseling in South University in West Palm Beach. And for me, it's a very interesting experience. It has been very good. I am now in the middle of my master's degree. And one of the things that for me are interesting are the situation of the whole, most of the field for students are drug addiction area. Is a very big business here in Florida, and maybe we can discuss it later, how it is possible that is the most important field for working, and maybe I am interested in other work later.
Very good. So what are you doing in here, who you are, and what drives you to become a mental health counselor?
My name is Heather Spreadborough. I'm from Southern California. My previous field's in chemistry. I have always wanted to be a counselor. I had a very unique experience when I was 22 years old. I had a therapist who really helped me and helped me grow as a person and showed me other ways to look at life. And when she was pro bono, she did my work pro bono, and I promised her that someday I would join the field and pay it forward. So that's what I've done.
Thank you, thank you. So you moved from California and from chemistry into Florida and mental health. Very good, very good. So how is the experience going so far?
I have really enjoyed my schooling. It's a little easier than my chem degree for the studying purposes, but the information is more interesting to me, and I do a lot of outside research to kind of add to my class time, and I'm now working 2 different internships. So I'm doing mobile crisis work, and then I'm doing a dual diagnosis facility. So I get to see both ends of the field and deal with people at various levels of functioning, which is really interesting.
And you moved from a different country, you know, and into Florida and the mental health profession. What differences and similarities have you noticed so far?
Well, it is, as I said, it is a very, very good experience for me. It's the same. People are the same around the world. I mean, human beings, as human beings, we are the same with sadness, happiness, family, daughter, sons. I mean, it's the same experience, but culturally, it's so different too. We have to be aware that even we think it's the same, little things that we don't realize because it's part of our world, and a little bit different. And for me, it's fascinating how I said to my colleagues sometimes, well, you know, this person maybe is having this problem, and they said, oh, why? Why they are so different, or why they are so unhappy? And I said, because they can understand this culture, because they come from another country, and they are different. They need maybe a hug. And for example, and here said, you cannot touch a client. And people from Latin America love to be touched, love to be hugged. And sometimes people feel that's not, the therapists don't care about them because they don't hug, and they cannot understand that it's a cultural thing. So it's so fascinating how we can understand and get together people and get to people from different culture, counselors from different culture, to understand our culture and to be to grow up as a counselor for other cultures. I think that's fascinating, and for me has been a very good experience.
Very good. Very good. So, in your experience so far, what do you remember work best for you when working with these therapists that help you? What were the kind of things that you feel were most helpful?
I had severe trauma in my life, and I had a therapist in 1992 who had trained in EMDR, so it was right as it came out. And EMDR for me was a godsend. Every time I walked out, and I know this probably isn't the norm, but every time I walked out, it was like a weight lifted off my shoulder, and I would go to the beach and have a picnic, or I would go to the park and, run around or do whatever, because it took away so much of the pain that I had been living under for so many years.
But that's the technique.
Yeah.
What was on the part of the therapist that you felt comfortable and helpful?
Lisa was a very empathetic woman, and she truly cared for me as a human being. She was also my aunt's therapist, so there was a little trust built there even before I walked in the door that really helped.
So if you were to suggest, based on your experiences and what you have learned so far, if you were to suggest to other counselors to be, or counselors in training, what things you would recommend bringing to the table in working with clients, what would you suggest?
Meet clients where they're at. I know sometimes for me, I struggle because I'll use words that people don't understand. And so I work very hard to realize what the language is of the person that I'm dealing with, where their level of education is and that kind of thing, and try to meet them where they are in their language, in their pace of speaking, in their time, in the time that they're dealing with, just to make them more comfortable. Because I think if people are comfortable around you, it's easier for them to open up and tell you things that are not necessarily comfortable to talk about.
You have an experience, with biculturalism, So what will you suggest counselors to do to provide a more effective service to their clients?
Yes, there's one thing about language. I was very concerned, very self-conscious about language, because I thought it was going to be difficult for me, being English my second language, to go through the client. And I was worried about that. And sometimes I said, well, if I don't know how to speak to them, if they can understand me. But I feel if you are there for the client, if you try to be authentic with the client, if you really are really concerned about the client realizes that. And the client is going to understand you. But you have to be there. You have to be really, it's not just a job. I mean, you cannot use counseling as just a job. This is more than a job. It has to be for you, your passion. It's a human being in front of you, and you have to be there for that person.